Hi, everyone. Welcome back to Both Sides of the Stethoscope podcast. As you know, we had left you off with a Thanksgiving series, and then we kind of disappeared. Unfortunately, that was due to scheduling issues with, of course, both being in the heart of our fellowships, as well as the holiday season and the COVID surge that both Alin and I have been dealing with. But we're both back. Alin,
we're back.
I know you were sick before when I did that episode with Steph, my friend who's a nurse. So how have you been feeling?
I've been feeling good. Actually, I got sick again. I just keep testing myself for COVID because I do work in an ICU where there are COVID patients, and I'm generally not exposed to them, but just in case. But I've been tested 1,000,000 times since November and I'm still negative. But yeah, I've been doing much better since then. I remember I actually had to go to LA for that when you guys were recording that episode. I was in LA and that's when I got sick. So it was terrible, but feeling much better.
Yeah, and somehow throughout this COVID surge, you and I have both avoided COVID.
Right? And we both work in a hospital.
Yeah, we both work in a hospital. We're both immunocompromised and we keep avoiding it. And I guess that it makes masking at least seem like it can work. Yeah. Because I feel like that's how me and you have avoided it most, is because we wear masks at work all the time. Masks
everywhere at work. And then I generally just try to not go out that much. I'm pretty much, especially since Omicron, I've just been home. Other than working, I'm just home, which makes it easy because we're fellows. So we don't really have much time off. So
yeah, and funny enough, I just got my antibodies tested again, and I have so many antibodies, and I'm so thankful.
So many, and you have to give me some.
I have the most antibodies. I don't know why. It's very rare in our immunocompromised population. I cannot put my finger on why I have so many, but thankfully I do. But you have none, and you haven't gotten COVID either. So
I have 0 antibodies. I've gotten my 4th booster, have not gotten COVID, but I think that does go to show that there is some sort of protection. Even, antibodies are the only test that we have now, but that doesn't mean that's the only thing that, shows how immune you are to COVID. So at least we have that going for us. But with that being said, there is a plan that I made with my doctor about whether or not I need to get Evusheld, or I don't know how you pronounce it, Evusheld.
That works for me.
Yeah, which is that monoclonal antibody infusion that people are getting as prophylaxis, and they're giving it only to immunocompromised high-risk patients. We talked about it last week, but I haven't really made up my mind yet, so we'll see.
Yeah, I think, if needed, I'll donate you some antibodies.
Thanks, Colby.
So let's get into what we're going to be talking about for today's episode, which is you just celebrated 3 years post-transplant. So when exactly was that?
3 years on January 15, 2022.
Yeah, congratulations.
Thank you.
2 years of your transplant, post-transplant life has been spent in a pandemic. So it's such a, unique experience. I think way different than my first 3 years of transplant, where I was just kind of sitting at home, getting better, making sure I felt great, studied for the MCATs, did a year of grad school, and then went to med school, where you have 1 year into your, transplant, you got thrown back into residency and fellowship during a pandemic.
Yeah. Yeah, it was pretty crazy. So I got my transplant in January of 2019, and the first 3, 4, 5 months, you're pretty much hyperimmunosuppressed. So I didn't leave my apartment at all. My mom came to stay with me those first few months. And then after she left, I started to kind of get my life back together. I went back to work, and I was overall slowly feeling better. But then COVID happened just less than a year later. So since then, I just feel like I've been doing exactly what I did do the first few months of transplant. I really haven't had a break from, just being totally free and being able to do whatever I want. Not that you're able to do as much as possible when you do get a transplant, but now it's a little bit difficult just because of COVID. And by that, I mean, it's in the beginning of transplant, they do have these different rules. You shouldn't go to crowded places. You shouldn't, travel the first year. And so I haven't really done any of that since my transplant. So it's been a while. And I feel like COVID just exacerbated everything. But I'm not complaining. It's nice. Sometimes people ask me why did you go back to work? And I'm like, well, I want to go back to work. I feel like it wasn't, nobody forced me to do this. I could have just not gone back to like ICU or ER, but I really wanted to, just to prove to myself that I can and show others that, you can live a relatively normal life with transplant.
Yeah, exactly. And I remember when I first got mine, in like the first time period, I was wearing a mask out in like the mall and stuff. And but I had many years of like carefree living post transplant,
Right,
and
right.
you haven't been able to really have that moment yet where you can think, oh, I'm long enough outside my transplant, I don't have to be so worried about immunosuppression. But with what we're dealing with now, you haven't had that true carefree time period yet.
Exactly. And again, we're not saying that you should be totally like carefree and not wear a mask at all, but it's just a little bit easier when there's no pandemic, right?
Yeah, no, I had, go to stadiums,
Yeah, which I
indoor,
haven't been
outdoor,
to yet.
full,
Yeah.
no mask, and that type of thing has not been part of your life yet.
No, I'm dying to go to like a basketball game now that I live in Brooklyn. I mean, in New York, I want to go to like a Nets game, but I can't. But it's okay. We'll see what happens.
We'll get there.
Yeah, we'll get there. We'll get there.
So I think one of the things our listeners would be interested in is kind of how you have handled these first 3 years as transplant patients. Once the transplant itself happens, you remove kind of true heart failure and heart disease from your list of medical problems you're dealing with, and you switch over to new concerns and issues, and that's immunosuppression, but also there's post-transplant infections that you can get and other side effects from the medications. So kind of tell us some of the major events or illnesses you kind of got after transplant and how you were able to navigate through that.
Sure. There's a few things that happened to me, and I'll go through a timeline. So basically, the first couple months out of transplant, one of the major things you worry about is not only like infections that you acquire, by the community or in the hospital, but another thing you're worried about is rejection. Acute rejection could happen at any point, especially in the beginning of your transplant or post-transplant period. Early on, I want to say like less than a month, maybe even, yeah, like less than a month after I was discharged, I actually had an acute rejection episode. And it was diagnosed just by a surveillance biopsy. So, as an outpatient early on in transplant, you have to go get right heart catheterizations where they actually get a biopsy of your heart and check under the microscope to see what's going on with that tissue. I think maybe it was the second one that I had, and it showed acute rejection. And it was 2R, so I think it's graded, and you can correct me on this, I think it's graded like 0, 1R, 2R, 3R, with 3R being the worst and like 1R being not so bad and 0 being no rejection.
Yeah, no, that's true. And I myself, thankfully, knock on wood, have never dealt with rejection. So when you had this, did you have any symptoms, or was it just because of the surveillance testing? And then once they found it, how did they, treat it?
Yeah, so I don't remember having symptoms, but again, it was early on in the post-transplant period where like I wasn't fully myself, like I wasn't like as active. I had a lot of joint pains, I remember, but no shortness of breath, no lightheadedness. I didn't have any chest pain, which is generally how these things present. I don't remember any of that being, I actually don't remember having those symptoms, but again, I might be wrong because it was like right after my discharge. And it was just caught on this surveillance biopsy as a 2R. They called me with the results, and they said that I would need 3 days of steroids, basically just high dose steroids, which is we use it all the time in the hospital, just Solumedrol. I think it might have been like twice a day dosing, but what I was able to do, which was great, was just do it at home. So there was a nurse that came in to my apartment and actually put in like an extended dwell catheter, like an IV in my arm with ultrasound. And then we were able to just use that line. We covered it up really well, and I wasn't supposed to get water on it and stuff, kind of like a PICC line. And we used that daily for my infusions. And every day, like they would send me the new Solumedrol like infusion, and I would just hook it up and do it myself. I think maybe the nurse came by one more time to check everything, but after that, it was pretty easy to do. And it was like 3 or 4 days, I think maybe just 3 days of the steroids. And I remember actually it was right around my birthday. My birthday is this upcoming Saturday, it's January 29th, and it was right on my birthday that I got diagnosed. So I remember having that like extended dual catheter in with like a cake, and I was like so miserable. I was just like, this is great. Like I just want to have cake, and like I have all these things going on. but I still made it through. And then after that, I think, if I'm not mistaken, you still stay on. So instead of getting tapered down on steroids more quickly, you actually stay on them for a little bit longer just because of that rejection episode. And then I was getting echoes of the heart done maybe more often for the first month after that rejection episode, just to make sure everything was okay. But after that, knock on wood, I've never had any rejection episodes. And then since then, they actually switched over the way they surveil for it. And it's through this test called AlloMap, which is basically a blood test that shows whether or not you have rejection. So early on, they usually do the actual catheterizations, and then they move on to do the AlloMap testing, right?
Yeah, I think that's become like the national standard at this point, as everyone has kind of picked up the AlloMap, AlloSure, HeartCare blood testing that is now done to detect for rejection once you've been a certain time period since your transplant. And I see it mentioned a lot on like transplant message boards and stuff about people asking like, hey, you know, is it true that you can maybe have rejection and not notice? And I think initially that's definitely the case. And then my understanding over time too is, you know, because of the deinnervation of the heart, we don't have the same ability to detect things going on with our heart as, you know, the normal population does. But just because of being 10 years out and having spoken a lot with people who have been through this, it sounds like later on, if you go into rejection, it starts to develop the way you would see heart failure develop, with people starting to notice that they're retaining fluid in their lower extremities again, or having, you know, shortness of breath on exertion and things like that. And at this point, you know, still early in my career, but my understanding is that the treatment is, like you said, just getting you back on high dose steroids and seeing if you can continuously get that function back to the heart when you remove that acute rejection that's happening. And that way, and the best way to check it is patient symptoms and their echocardiograms.
Yeah, since then I've had plenty of echoes, and even now, like anytime I'm worried, I say like, "Do you think I have rejection from this like XYZ symptom?" And we just do a quick echo, and I think that's basically what my cardiologist said too.
So that wasn't the only
No.
little bump in the road that you've had since transplant. So what was next?
Steroids are amazing because they are the treatment for so many things out there, including like COPD and lung disease and rejection and a lot of the rheumatological diseases. And, you know, we use steroids all the time in the ICU, but unfortunately, they also have terrible side effects. Some people call it the devil's drug because it just has so many crazy side effects. Anything from like muscle aches to like decreased appetite to increased appetite to insomnia, but they also have long-term effects, which I found out about later. So 6 months after, you know, my heart transplant, I went back to work and everything was going really well. I was very, very active early on. Even I remember within a month of maybe a month and a half, a month of discharge, I was already jogging and, you know, I was feeling great. So I never thought I would have any sort of like muscle or joint issues until about a year and a half after my transplant. So I moved to New York City and I started having these terrible leg pains, like down from my hip all the way to my knee. And I was just I was in so much pain. I remember I was in so much pain that like I was waking up at 4 a.m. every single day because I had to be at work around 6:30. I was waking up at 4 a.m. just to put like ice packs on my knees and my hips, and then I would like take 2 Tylenol, and I had a whole routine. I would put my like legs in like warm water, cold water. I would just do a million different things until it kind of felt better, and then I was able to walk to work. But within a couple months of having these symptoms, I ended up going to the ER because the pain was so bad and my whole left leg was swollen one day. So I thought for sure I had a blood clot or DVT in that leg. When I went to the ER, they did an ultrasound to check for DVT, and that was negative, but they also did some x-rays, and that showed avascular necrosis of my hip joint. AVN is, I mean, it's not super common, but it is a side effect that you can get from high dose steroids later on. And generally speaking, like I was only on the high dose steroids that initially with my rejection, and then obviously like I was tapered off of steroids maybe over a period of 6 to 9 months. So I wasn't even on it for like that long. There's definitely people who are on it for longer and never get AVN. Mine was kind of a weird case, and I talked to the orthopedic surgeon later on about this, and I said, you know, sure, I was on it and it was high dose, but like there's definitely people who are on doses since they're kids, and like they do fine and they never have these issues. And he said what really matters is if you're and I haven't checked the literature, but this is what he told me, is if you're like steroid naive and then you suddenly get a high dose like burst of steroids, which is exactly what happened to me. I had never had any steroids my whole life, and then suddenly I got like blasted with these crazy amount of steroids, and then the effects took place like a year and a half later.
Yeah, and you and I are, like we've mentioned before, in a group of physicians, all of who had transplants, and unfortunately, you're not the only one who's had to deal with this.
Yeah.
And so, how did they end up having to treat you for this?
I had to get joint replacement, so I got both my left and my right hip replaced. It was I did it, so it was getting worse and harder for me to walk, and I was trying to really space out the replacements so I wouldn't need to do them so young, because replacements, total hip replacements don't last that long. Like the implant lasts maybe, I don't know, 20 to 30 years max. So my thing was like, let me see if I can deal with this for a couple more years and then get them. But like, no, like within a month, I was like, no, give me the replacement. I can't do this. So I got I got my left hip replaced first, and then I got my right hip replaced just a couple months after. And since then, I'm doing fine as far as the legs go. Barely have any more joint pain. I'm back to, I just cycled like 6 miles yesterday and the day before. I'm doing as much as I could with low impact exercises instead of high impact exercises. But with that being said, I then after getting my hips replaced, I started getting short of breath last year. So this was 2 years after my heart transplant and like 6 months after my first hip replacement. But last year I started having the shortness of breath and like lightheadedness. And then I went to the ER thinking I was probably in rejection. But this is like a super terrible way to look at it. But in my head, I was like, I hope it's a blood clot and not rejection. Like that's the kind of things we have to do sometimes. And it ended up being that I had a pulmonary embolism, or a blood clot in my lungs. It was provoked because I had the immobilization from the surgery. And yeah, so after that, it's just basically anticoagulation, which is just something called heparin, which some of you know about. They put me on heparin, and then I was transitioned to an oral anticoagulant that I only did for about 3 months, and then since then I've been okay. Knock on wood, I've been okay.
Yeah. So, and I think that's important for people to realize. One, glad that you're doing okay. I don't know how you were able to stand up for as much as you did. I'm on my feet all day, and I can't imagine having AVN and dealing with that. And then two, I think, the idea is that, oh, you got a heart transplant, now your heart is really healthy, but it's really just a trade-off, unfortunately. I wish it was just a cure-all, but that's really not what it is, and had to trade off, heart disease and heart failure for these other things. And the hardest part about it is you don't know what's going to pop up next. And I know in May, I'll be celebrating 10 years, and you and I will be back again doing my reflection on 10 years of dealing with this. And I have my own things that I've been through. I thankfully haven't had to have both my hips replaced. So I think it's, amazing your outlook and after everything you've been through.
Yeah, I think the way that I saw it was like, man, I've been through a heart transplant. Like, I can't complain about anything from here on out. Like, there's nothing harder than, a heart transplant surgery is something that it's like up there as one of the most amazing surgeries we do nowadays. So after that, I was like, I can't complain about a hip replacement. Like, this is going to be nothing compared to the heart transplant. I will say that after I got my hips replaced, so the pain before the replacement was terrible and I could barely walk, but the pain, the post-op pain was also crazy. Like, I remember, because they generally like break your bones and put in a new joint, so you basically have fractures on your hips, and it's a large bone. The femur is a large bone. So it was very painful the first few days out. And I even said that it was more painful than my sternotomy, which is the incision you get in the middle of your chest for a heart transplant, which is basically breaking your ribs apart. So I personally thought that the hip replacements were a little more painful than the heart transplant, but who knows? They were both terrible. But after a few days, once you start moving and you start walking, everything gets 100 times better. And I think I always just had something to look forward to, which is the way I tell others to look at this. Like, I was always looking forward to going back to work and having my life again and having normal people problems. Like, oh, I have too much work to do today, or like, oh, I can't sleep because I was at, the hospital for so long. So sometimes it's nice to have those like easier problems to think about, you know? It's like almost a blessing.
Definitely. And
And
so
yeah.
anything else that, not that a pulmonary embolism or bilateral hip replacements is not enough, but
I've had a couple infections here and there, but they've been like I had like a GI infection. And then of course I've had a couple of like sore throats, URI type infections, but I can't like knock on wood, I've never had like a pneumonia or anything too crazy. But everybody does know that once you're a transplant patient and you have a fever or any signs of infection, you do get the whole workup and they recommend that you stay home and they're very, very conservative on the treatment when it comes to immunosuppressed patients with any sort of infection because any tiny infection could lead to the worst thing in the world. You can even get like you can have a URI, which is just a upper respiratory infection, and then that could in turn cause a pneumonia, and then you can't fight that off, and then you're going to need to go to the ICU. So they're always very, very careful anytime I have any sort of complaint. But luckily, I've only had a couple of those infections, and it was nothing crazy. I was able to still, just take antibiotics and do fine. Other than that, I remember other than that, I've had no issues. I've just been trying to live my life in the middle of a pandemic.
Yeah, which is what we all kind of wish for once we come out the other side of the transplant.
Yeah.
How has your mental approach to this, has that changed at all? Like, how do you feel you were thinking, a few months into transplant to now 3 years later? Are you more optimistic, more pessimistic about where you think, your life's going dealing with all this?
I think I'm still in the same mindset. Like one of the major things, again, I know I keep talking about work, but I do love what I do. When I first got the transplant, my main thing was like, if I can make it to 6 months from here, I'm going to go back to residency. And then like once I started residency, like I'm still going to do my fellowship. So like I always really wanted to do everything that I said I was going to do, 10 years ago and complete those and then kind of see where my life took me. I do find myself being a little less type A about things. We're all a little type A in medicine, but I am just more relaxed. And I find myself not worrying as much about the little things. And, and I think that's kind of because of the transplant. Like, I think that there's issues that you have to really worry about in life. And then there's some things that you just kind of gotta face and move on. And I think that mindset really, really helped me in the beginning of transplant. And it's gotten even more, I'm even more like that nowadays. So I kind of see things, you have to live life one day at a time. If you're facing issues, you got to face them and kind of move on. And that's kind of how I do everything. And I think I keep getting these emails like, oh, you're so inspirational. And it's really nice. Like I'm so appreciative of all those emails and messages that I get from people. But at the same time, I keep telling people like nothing, I didn't do anything. Like this heart transplant happened to me and I just took what I could from it. And I think that's kind of the way that you see everything too.
Definitely. And I 100% agree that I am more chill after my transplant. It's just one of those things, you can't help it. You are just, thrust into this thing, like life-changing moment. And it will change your outlook on life and what you see as kind of like a big deal or not, which I think, sometimes drives people that are close to me nuts because I don't have the level of like care about smaller things that most people probably do. But what can I say? I am who I am now.
I know. That's so funny. That's what people like. How are you so calm? How are you so patient? I'm like, once you've been through what I've been through, like nothing could really get to you. And if it does, like that's when you know it's something big. But yeah, I think it's a good approach to life. Again, it doesn't mean that I don't care. It just means that I'm just a little more relaxed on the decisions that are made, on the decisions that I make, and things that happen to me. Ultimately, this is so cheesy, but you only live once, and you only have this one life, and you can't let every little thing get to you. And the other way you could see it is a lot of people are like, oh my God, if that happened to me, like if you got a heart transplant, if that happened to me, like I would die. Like I would never be able to handle that. And I'm like, you think that until it's thrown at you, and then you realize how strong you are, and then with that strength, you can do so much more in life. So it's crazy.
I tell people the exact same thing.
Yeah, exactly.
You don't realize what you're capable of when you're quickly thrust into that position, which is good. They still are like, oh, it's amazing what you did and how your mental approach to it. It's like, listen, I'm telling you, if you found yourself in that same experience, you would handle it much better than you realize.
Yeah, I say the same thing.
For the most part.
Yeah, no. I totally agree.
Anything else you want to add?
I think that's it. Let's go to the question.
All right. So one question we got on our Instagram from Naomi, who has had a heart transplant herself, it looks like, says, have you noticed reinnervation of your heart? And she adds, can't wait till hers is back in the loop. So for those that, don't realize, when the heart gets transplanted, you have a bunch of nerves that innervate the heart, and those need to be cut, of course, as you're taking your heart out and placing a new heart in. And there's an idea that some of the nerves are able to regrow and attach themselves to the heart. The nerves that are able to do this are the sympathetic nerves. So these are the nerves that kind of are more of like your fight or flight response and kind of can get your heart rate going and get you to maybe have more exercise capacity. The other nerves are called your parasympathetic nerves, and these are the nerves that kind of use what we call your rest and digest nerves, and these kind of help you relax and things of that nature. And data shows that those nerves likely don't ever reinnervate the heart. And even the sympathetic nerves that do grow back into the heart, they kind of do it sporadically, and it can take like even up to 15 years, the ones that are able to. And so, unfortunately, the reinnervation of the heart after heart transplant is not as robust as I think people would like. And I don't know about you, Alin, but when I got my heart transplant, the thing that I noticed the first was how robust my heart was like pumping.
Mm-hmm.
And I could feel like the heart rate. And for me, my heart rate hasn't changed. My heart rate is always higher probably than the average human at rest. It's around like 90. And that's even taking some medications called calcium channel blockers that keep it at a lower rate. And so I'm not sure what Naomi was, kind of getting to, but
right.
Part of me wonders if she's wondering about kind of the
heart rate going back down.
The heart rate coming down. And unfortunately, I don't foresee that happening other than with medications, as those nerves likely won't be reinnervating the heart. I don't know if you've noticed that your heart is maybe a little bit too noticeable to you or something like that.
No, so like I the same exact thing with me. And I've asked many people this. I actually had an Instagram poll about this once, and like wanted to know if people still had higher heart rates, and like most people, even like 1 year out, 2 years out, 10 years out, 20 years out, still have an elevated resting heart rate. So normal heart rate is anything between 60 and 100, with like closer to 60, 70 is like generally what people are at with native hearts. And then, if you're an athlete, it could be even lower than that. But mine, in the beginning of transplant or the post-transplant period, mine was like 110 all the time. And then now it's like 95 to 100, and I'm 3 years out. So, I mean, I think it's kind of cool. Like anytime we're in the ICU and like we're explaining to residents the pathophysiology of like heart transplant, I just like show my Apple Watch and I'm like, hey, like I have a heart transplant and mine is, look, it's like 105 right now and I don't even feel it. So, so no, I don't think I've had any changes either. My exercise capacity has been fine. Obviously I took a big break with exercising often when I first had to get my hip replacements, but before my hip replacement, that first year out of transplant, I was running fine. I was getting my heart rate up with no issues. Obviously, there's certain precautions you have to take so it doesn't go too high. And then now, I'm back to it. Just yesterday when I exercised, my heart rate went up to 140. And then it takes a little bit longer for it to settle down just because of the de-innervation. But overall, like physically, I don't feel that different, but I don't know if that's normal for everyone.
Yeah, I'm able to hike and like I do spinning and go for walks and all that. And I have no problems with exercise. I do know that I've done a couple stress tests after transplant on the treadmill. I don't hit the target heart rate for my age. And they say that's what they notice for the most part in transplanted patients, is that they're able to do your everyday exercises and stuff, but that extra kind of step that maybe would require more sympathetic innervation of the heart, they're just not able to get to that super high heart rate.
Yeah, you're right, actually, because I remember I did a dobutamine stress test and they couldn't get my heart rate high enough, but I mean, they got what they needed and everything looked okay. It was like almost there.
Yeah, so Naomi, sorry if our answers weren't exactly what you were hoping for. I do think you will get some reinnervation of the heart, but this is kind of, I think, where our hearts are going to stay for the rest of our lives, which at least thankfully we have that. We have, I think, with where transplant is going, we have long lives to live after transplant.
Absolutely.
And then we'll do one other question. This is a general doctor question, not so much a heart transplant question, but right. Came from James in the email, and it says, how are your hospitals looking with this latest COVID surge? Is it true Omicron is not as bad? For full disclosure, I'm not an infectious disease specialist, but at least in my hospital, the surge is worse than any surge we ever had. The ICU numbers did not reach the highest we ever had, which I think just comes from having 2 years to learn how to treat this. Yeah. But we had the most ever patients in my hospital that we've ever had diagnosed with COVID.
Yeah, that's crazy.
Yeah, and there's definitely a unique, from the initial time when COVID started, I was just a resident, but the patients that came into the hospital because of COVID, like all had COVID as their primary diagnosis. They were coming in. And now being here in cardiology, like we're seeing patients with like heart attacks and things like that who are also found to have COVID. And it's like, it's not their number one reason they're coming in. And it's like, is it causing them to have, increased clotting or something leading to the heart attack? I think that's much larger studies need to be done. Yeah. But overall, number wise, we actually got hit hard by this Omicron surge right now.
I think us too. So I wasn't a resident in New York City at the time when like that first surge happened. And remember, New York had it like really bad. I don't think the numbers right now, at least in the ICU, are as bad as that first surge, but they're definitely a lot worse than like 2 months ago. We are seeing that, again, the part of it has to do with the fact that we kind of know how to treat it better. Like we're not intubating every single person with COVID, which is what we were doing initially. Now we're able to kind of give them some high flow or BiPAP before, and then see how their lungs do, and then only intubate if needed. I think our numbers are definitely a lot worse than about 2-3 months ago, but not as bad as that first surge. And I can only speak to the ICU. I think that's where I work. And same with us as far as people having incidental COVID findings, or COVID positive findings. So, now every single person who comes through the hospital, whether they are admitted through the ER or not, or they come in for elective surgeries, every single person gets a COVID test. And because of that, they're still doing some surgeries, like especially if they need some sort of open heart surgery that they can't put off. However, they end up having COVID as well. And we can't tell whether it's the COVID that's like worsening their cardiac or pulmonary processes, or if it's just we incidentally are finding COVID when they come in. So it's kind of hard to tell, and it's pretty much the same as you.
Yeah, and as to if Omicron is not as bad, I think there's definitely data out there to make that argument that it's not as severe of a disease as the initial, or I guess if you compare it to Delta is the easiest way to compare it. What I've seen, though, is with any respiratory virus illness or any really infectious, the effect it can have on someone always varies. So somebody can get very sick from the same infection that somebody can be fine with. And I think the concern with Omicron isn't so much, it's such a severe disease. And even though it is less, it's because of how infectious it is. It can infect so many people so quickly that even if it's less severe, there are going to be those people that do get severe disease from it. And because you have so many people being infected, that's still a very large number of people that end up very sick and in the hospital and overwhelming hospital systems. And I think that's where we're still seeing like a surge in hospitalizations, even though more people probably are getting this variant than any of the ones before.
Yeah, totally agree.
And so I think with that, we'll end this episode. Our goal right now, and this is like our second try at this podcast, and thank you to everyone who listened to our first 8 episodes.
This is our season 2, okay?
Yeah, this is now season 2, exactly. And our hope at this point is to release episodes every 2 weeks, and hopefully we can stick to that. Scheduling is still very difficult at times, as Alin and I kind of try and navigate our fellowships in 2 different states, 2 different hospitals, 2 different specialties. But we'll do what we can. In the meantime, it's very helpful if you guys like us on Instagram and on Twitter. Both are at both sides of the stethoscope. And we would love to have you continue to ask us questions.
Or you can feel free to email us at bothsidesofthestethoscope@gmail.com with any questions or comments that you have.
And in 2 weeks, we will be back with an episode talking about our genetic heart disease and how that made us think about family life and things of that nature.
Yeah. We'll see you soon.
See you soon.